If you experience sharp stomach pain, fever, or cramping that won't go away, you might wonder if it's, well, something you just ate, right? But it could be something way more serious, such as diverticulitis. Joining us to explain the symptoms and, most importantly, the treatments, Dr. Jonathan Tsai, a general surgeon at BayCare St. Joseph's Hospital North. Welcome, Dr. Tsai. It is a pleasure to have you on the show today.
Absolutely.
And as I asked before we even got started, this is something that you see all too often. So let's first explain what it is.
Sure. So diverticulitis, it's a disease of the large intestine, the colon, okay? It happens when you have these pouches that develop through weak spots in the colon wall naturally, okay? Diverticulitis is inflammation or infection of those pouches, and that's what's called leads to diverticulitis. Now, it's not to be confused with diverticulosis, which is just having the pouches but not the inflammation. You may see that on your colonoscopy result.
Interesting. I was going to ask that because I've heard both words and I thought it was the same thing. So I'm glad to know it's very different.
Very different. Right.
Let's talk about symptoms, though. I kind of set the stage talking about fever, cramping that won't go away.
Sure.
Are some of those signs like signs to go to the hospital?
Absolutely. So the most common symptom of diverticulitis would be pain in the left lower quadrant of your stomach or the abdomen. That's just where the most common area you would have diverticulitis from your colon. Other symptoms, nausea, vomiting, you can have diarrhea or constipation, and sometimes fever. Now, I would say if you have any of those symptoms and they are unremitting, they get worse, that's the time to go to the emergency room.
Because let's be honest, sometimes we can deal with any of those symptoms, on a regular basis. So I'm glad to say they don't go away, they get worse.
They get worse.
That's a key right there. And I was asking too before we got started, risk factors. Do you see certain risk factors that maybe someone at home may know that's something to really look and pay attention to if they have these symptoms?
Absolutely. So those that have chronic constipation, that don't take enough dietary fiber, for example, from fruits or vegetables, sometimes smokers or those that have high intake of red meat or an inactive lifestyle, not much physical activities. Those are all contributing risk factors for diverticulitis.
Okay, so you get the diagnosis, you know what's going on. Let's talk about what you can do to help.
Right. And so if you are seeing some of those unremitting symptoms, you're coming through the emergency room, you're probably getting a CT scan, right? The first line of treatment for diverticulitis is antibiotics, right? We want to treat the infection, calm the inflammation, okay? But if the antibiotics aren't addressing the diverticulitis well enough and you have continued pain, fevers, and things like that, you're probably looking at surgery.
I knew since you were a general surgeon, that S word was going to come up at some point, wasn't it?
Right.
Well, when you are faced with these kind of things, I feel like it can be scary, but again, being able to get that diagnosis can help. And it's so popular, or you hear this so much, that you even have a free clinic to help those. Talk about what you're doing for the community, because you do see this in your office.
Right, and so we're having a community event on April 4th at St. Joseph's North. Having a little community event, a lecture to discuss things about diverticulitis, what to look for in terms of when you're at home, kind of what to expect from your primary care physician, and what to expect when you come into the hospital setting through the emergency room, right? If you're headed towards surgery, what are the options? And at St. Joseph's North, we do offer a minimally invasive approach, right? We make very small incisions, much smaller than your typical traditional large incisions where we're having to put our hands in there to take out the problematic part. Small incisions means less pain and less time in the hospital. On average, 2 to 3 days versus 5 to 7. You're home earlier.
And then is this something too, then once you have that removed, you're cured in essence, or is it something that can happen again?
That's a great question. So for the most part, where we deal with diverticulitis, that part we take out is the most common and most frequent area for it. It's not to say that you won't necessarily ever have diverticulitis again, but the chances are much lower.
I got to say, just even starting this conversation, I found myself having so many questions. So that's why it's so important that there is this free community event. And again, we are sharing that information from Dr. Tsai as well. BayCareEvents.org is where you can register. Doc, thanks for your time today.
Thank you for having me.